Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, we're going to have an in-depth look at the real causes of chronic tinnitus, hearing loss, and vertigo, and show you some solutions that work. So, without further ado, let's dive right into it. A wide variety of so-called ear noises are grouped under the general term tinnitus. Usually, those noises are described as a hissing sound, ringing, buzzing, thumping, whistling, or roaring sound. Whatever their nature, they are annoying, that's for sure. Tinnitus can be constant or intermittent and is often accompanied by hearing loss. Many consider the causes of tinnitus to be exposure to loud noises, for example, after a very loud rock concert. It may come as a side effect of medications, ear or head injuries, diseases of the ear infections, emotional stress, hearing impairment, and the aging process. In Western medicine, other causes are considered to be infections such as meningitis, toxic disturbances due to large doses of quinine, streptomycin or salicylates, excessive smoking or alcohol consumption, cardiovascular diseases including hypertension, aortic regurgitation, arteriosclerosis, Meniere's disease, obstruction of the external auditory canal or the Eustachian tube, endocrine disturbances, allergies, and hysteria, amongst other causes. Tinnitus is the sensations of noises that ring in the ears or the head. However, it is important to understand that tinnitus, this sound that you're hearing, is not generated in your ears. It is generated in your brain. The neuronal disruptions induce an abnormal activity in the keyboard cortex, and as a result the neurons start to fire spontaneously and they generate specific signals, so sounds. And due to possible interactions at the neuronal level between the sensory and auditory cortex, where the tinnitus is controlled from, different emotions and stress, being distracted, unable to concentrate, suffering from depression, being tired, nervousness and anxiety can occur as side effects of tinnitus. This is what we know as neurosynchronicity. For individuals with long-term tinnitus, one or more of the causes I've mentioned have led at some point to an auditory impairment. And the brain's attempt to compensate for this malfunction is the start of a vicious cycle. The auditory cortex is the part of the brain that is responsible for your hearing, and every stimulus perceived by the ear is transmitted to and processed by this auditory cortex. The nerve cell assemblies in a specific area of the auditory cortex are tuned, so to speak, to a particular frequency, similar to the arrangement of the keys on a piano. No matter what the trigger may be that is responsible for the tinnitus, whether it's noise, medication, stress, or all of the above, they all lead to an interruption of the signal transmission from the ear to the auditory cortex. And this means that some of your nerve cell assemblies no longer receive signals. To stay with the piano image, some of the piano's keys no longer work and or cannot be struck by the pianist. However, these nerve cell assemblies do not react to the lack of stimulus by simply remaining silent. Instead, they begin to chatter spontaneously and become synchronously attuned to one another. Once they have become hyperactive and synchronous, the nerve cells simulate a tone that the brain hears, and that is this tinnitus tone. Returning to the piano analogy, the broken keys have created their permanent fashion even without the keys being struck by the pianist. And over time, this pattern strengthens and the tinnitus becomes permanently anchored. Thus, the brain has learned this phantom sound. To understand the underlying actual causes of tinnitus, we must look first at the anatomy and physiology of the ear and the auditory channel. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Alternatively, you can also support us directly via the built-in systems on the video platforms you're watching this video on. For the holistic healthcare you need and deserve, and yes, we know how to take care of your tinnitus as well, please do not hesitate to contact us at christine.doctor and check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links, as always, also in the description box below. And do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. So, let's get a better understanding of the physiology of the ear and the auditory channel. The cochlea is a spiral-shaped cavity in your inner ear, and it is the sensory organ of hearing. The cochlea receives the sound waves from the outer ear through the auditory canal and converts them into electrical impulses that are transmitted to the brain via the auditory nerve. The auditory nerve, or vestibulocochlear nerve, is divided into the vestibular branch concerned with balance in motion and the cochlear division that is responsible for hearing. The cochlea originates from the ectoderm and is controlled by the postsensory cortex, which is part of the cerebral cortex. The cochlea in the right ear is held from the left side of the cortex, and in the left ear it is controlled from the right cortical hemisphere. Hence, there is a crossover correlation from the brain to the organ. The cochlea shares the control relays with your vestibular organ, and therefore often tinnitus, vertigo and hearing impairments are interconnected, even though the psycho-emotional triggers are different. The biological conflict that is linked to the cochlea of the inner ear is a hearing conflict that is experienced as the feeling that you don't want to hear this. Aggravating noises such as dog barking, a screaming child, construction noise caused by jackhammers, chainsaws, generators, etc. Traffic noise such as this coming from loud trucks, sirens from ambulances, fire engines or police cars, noisy neighbors, lawnmowers, grass trimmers, loud and annoying music, the nagging voice of a person, or something upsetting that has been said, where you have the feeling that I cannot believe what I just heard, are examples of what might trigger this type of conflict. Often hearing conflicts also occur on the phone, and musicians and music lovers with excellent ears can already suffer such a hearing conflict when they have a poor musical performance. For someone who is noise sensitive, the slightest noise can already cause ear-related distress. Functional loss of the cochlear branch of the vestibulocochlear nerve results in the perception of sounds in one or both ears without an external source, and this is what we call tinnitus. The cochlea, so the inner ear, belongs to the group of organs that respond to the related conflict not with cell proliferation or cell loss, but with hyperfunction or functional loss. The ringing, buzzing, humming, whistling, clicking, tinkling, hissing or roaring sound is a frequency of the sound that is associated with the hearing conflict. And the biological purpose of tinnitus is to be a warning signal saying, last time you heard this, you were in danger, so watch out. And this explains the wide variety of sounds that is heard by people with tinnitus. Depending on the magnitude of the conflict, the sounds or noises can be mild and only noticeable in a very quiet room, or they can become extremely loud, causing difficulties hearing external sounds. A person might also hear complete sounds or noises, such as engine noise, the ringing of a telephone, or a musical tune, or a recurring sentence or word. If the tinnitus is present all the time, this indicates that the conflict has not been resolved yet. From these pictures you can see that tinnitus really comes from your brain. You see that the auditory cortex response of patients with tinnitus is completely different than this from the one from the control group. Tinnitus can be a phantom sensation depending on three factors. First, the eventual peripheral auditory lesions. Secondly, central auditory reorganization. And thirdly, non-auditory gating. The non-auditory factors for tinnitus that link the tinnitus to the limbic system are that not everyone with hearing loss gets tinnitus. Often we see intermittent tinnitus in patients, and it is possible to treat tinnitus by modulating stress, emotions and sleep. And also there is a comorbidity between depression and stress with tinnitus. Here we have some pictures of patients that were measured using MRI techniques. How they react to unpleasant sounds, and the nucleus accumbens, that is in charge of pleasure and well-being sensations, as you can see, is trying to modulate and regulate these sensations. And therefore we can conclude that people with tinnitus have had a stressful, emotionally dysregulating event in their life, where they had a feeling that they cannot hear this anymore, or they cannot believe what they have just heard. Tinnitus is really a failure to tune out an unpleasant noise that comes into your inner ear. And there are slight differences, as you can see, between compensated tinnitus and tinnitus, but the fact remains that when you have this condition, you cannot tune out this noise. The brain relays of the inner ear are located right underneath the control centers of the coronary arteries, which are assigned to a territorial loss conflict for male, and to the coronary veins, which are assigned to a sexual match for a female. Hence, the hearing conflict, where you don't want to hear something involving the cochlea, can also have a territorial or sexual aspect, such as the voice of a predator or rivaling the territory, or the representatives of people and people from your family arguing in a house, or the voice of a sexual abuser, or hearing the parents having sex, or hearing that one sexual mate was unfaithful, etc., etc. And the same applies to the vestibular organ. When both hearing conflicts are associated with sounds and noises, the person will develop a double sound tinnitus that affects both ears. If one of the two conflicts or both were triggered by a person's voice, this leads to hearing voices or a hearing constellation. Conventional medicine considers hearing voices to be a mental disorder that they call paranoid schizophrenia. It is instead a double tinnitus, with the difference that instead of hearing one or more sounds, a person hears one or more voices. Additionally, traumatic hearing conflicts can result in severe auditory delusions. As a side note, when it comes to Down syndrome, Dr. Hammer made a groundbreaking discovery that Down syndrome according to him, is not, as assumed, caused by trisomy 21, so a third chromosome that is attached to the 21st gene pair, or mosaicism. It is instead a double sound hearing conflict that occurred within the first 3 months of pregnancy. Trisomy 21 can happen in the egg or the sperm even before conceiving, yet some children have trisomy 21 without the symptoms and characteristic features of Down syndrome. And this means that Down syndrome is treatable. Let's also have a look at hyperacusis, or hypersensitivity to noises. The middle ear contains 3 tiny bones called the malleus, the incus, and the stapes, and they carry the sound from the auditory canal to the inner ear. The stapedius muscle that is attached to the stapes is fundamental in reducing sound transmission. Under normal circumstances, the stapedius is relaxed, allowing thereby sounds from the external environment to be perceived with clarity. However, when a sudden, intense noise reaches the ear, the stapedius muscle contracts to reduce the sound in order to protect the inner ear from damage. The stapedius muscle consists of striated muscles, and the psycho-emotional conflict is linked to hyperacusis that manifests with contractions, spasms, or even paralysis of the stapedius muscle is, according to its function, an unbearable noise such as a loud bang, blast, explosions, shots, blaring sirens, music with very high decibel levels, a sharp cry, a piercing scream, and the like. During the conflict active phase, there is a cell loss of the stapedius muscle tissue, so necrosis, that is proportional to the degree of conflict activity, and also an increasing paralysis of the stapedius that causes the hyperacusis with the decreased sound tolerance, where normal sounds are perceived as being very loud. During the healing phase, the stapedius muscle is reconstructed, and the healing crisis manifests with stapedial muscle spasms that can create a painful fluttering sensation in the ear. But finally, the function of the stapedius returns to normal, and the initial noises are eliminated. When it comes to vertigo, the vestibular system in charge of maintaining body balance is located in the inner ear region, where the semicircular canals join the cochlea. And it is this part of the ear that regulates the sensation of balance when you are in motion. The vestibular organ is controlled from the postsensory cortex, and the vestibular organ is in the right ear is controlled from the left side of the cortex, and the vestibular organ in the left ear is controlled from the right cortical hemisphere. Hence, as you can see, there is a crossover correlation from the brain to the organ. The vestibular organ shares the control relays with the cochlea. According to its function, the biological conflict linked to vertigo is a balance conflict, more precisely a falling down conflict. Any accidental fall in sports, at work, falling down the stairs, slipping on a wet icy surface, a fall from a ladder, tripping over a cable, all of this could trigger such a conflict. Certain professions, such as builders, construction workers, roofers, infants, and the elderly, are more at risk. People with ALS or MS who have difficulties balancing therefore often live in fear of falling, also have a higher risk of this type of conflict. The same holds true for epileptics. The conflict also relates to seeing someone else falling or collapsing, witnessing, for example, someone having a stroke or a heart attack, or hearing that a loved one has dropped dead. In a transposed sense, the conflict could be experienced as a fall from grace also, or as feeling dumped, let's say, after separation from your partner. In the conflict active phase, we observe functional loss of the vestibular branch of the vestibulo-cochlear nerve that results in a loss of balance, and this is what we call vertigo. The symptom of vertigo is a sensation of spinning, swaying, or falling to one side. And the vertigo spins, should not be confused with lightheaded dizziness. Whether the tendency is to fall to the right or left is determined by a person's handedness and whether the conflict is mother-child or partner-related. Hence, if a right-handed person has a mother-related conflict, there is a tendency to fall or spin to the left, meaning towards the mother. If the conflict is partner-related, there is a trend to fall turning to the right, that is towards the partner. For left-handers, it is reversed. If the dispute concerns oneself, the falling or spinning always tends to the side which relates to the original conflict. For example, if the fall was to the left, the specific vertigo symptom is also a sensation of spinning or falling to the left. The brain relays of the inner ear are located right underneath the control centers of the coronary arteries, showing for a male territorial fight conflict and coronary veins linked to a female sexual conflict. Hence, the falling conflict involving the vestibular organ can also have a territorial or sexual aspect, such as feeling abandoned, forgotten, or neglected by the partner. And the same, as we have discussed, applies to the cochlea. Whether the conflict is experienced in a male or female fashion is determined by the person's gender, laterality, and hormone status. During the healing phase, the vertigo intensity diminishes, and the healing crisis manifests as a sudden vertigo fit, potentially accompanied by severe nausea and vomiting. The extent of the crisis symptoms is determined by the intensity and duration of the conflict active phase. Recurring vertigo attacks are triggered by setting on a track that was established when the original falling conflict occurred. Alcohol could be such a track. If the falling conflicts affect the vestibular organ of both ears, this causes a so-called vertigo constellation. The symptoms are wide-based and unsteady stance and gait with reeling or lurching movements. The medical term for this condition is Friedreich's ataxia. The physical incoordination and clumsiness are not the result of muscle weakness, but of the unbalanced equilibrium caused by the double vertigo. Since infants and the elderly are more likely to suffer falling conflicts, ataxia develops more often in childhood and later life. Meniere's disease, also known as primary endolymphatic hydrops, is, according to conventional medicine, an inner ear disorder that affects balance and hearing. This condition is a conflict combination of a falling conflict involving the vestibular organ and a hearing conflict involving the cochlea. Next, let's look at hearing loss. During the healing phase of tinnitus, the volume of the tinnitus sound decreases. However, the swelling created by the fluid accumulation in the inner ear, so the edema, may cause hearing impairment, loss of the frequencies of the tinnitus sound, or hearing loss, complete hearing loss in the affected ear. The average hearing loss happens in the middle ear and not the inner ear. And once the edema has been expelled, the hearing ability slowly returns to normal, provided, of course, no conflict relapses. Triggers that can reactivate the original conflict may be the odor of the messenger or visual track like the sight of the acoustic source. With a hanging healing, the tissue in the inner ear eventually wears out, leading in the long run to deafness. Therefore, it is essential to identify and resolve the actual conflict as soon as possible. Hearing difficulties often trigger also a self-devaluation conflict because of the inability to hear well. The self-devaluation always affects the tiny bones, the malleus, the incus and the stapes in the middle ear, resulting in permanent hearing loss or otosclerosis. Using a hearing aid while the inner ear undergoes healing can have a highly encouraging effect. The CT scan that you see here on the right shows an edematous in the hearing relay on the left side of the cerebral cortex, and hence the hearing impairment is in the right ear in this case. The yellow arrow points to the edema in the control center of the transverse colon in the brainstem. The related indigestible morsel conflict most likely occurred in this case together with the hearing conflict for a right-handed person related to a partner. The causative, etiology and pathology of tinnitus or deafness are due to the following 5 factors: kidney deficiency, outside factors such as wind, fire toxicity, and inflammation, usually coming from the liver and or gallbladder, and phlegm blocking the orifices, as well as blood stasis, so blood stagnation. When it comes to kidney deficiency, the kidney is supposed to store the essence, and that later can be then transformed into bone marrow to nourish the brain and ears, since the ears are the orifice of the kidney. Kidney deficiency may be due to the body type or chronic diseases. Then we have exogenous factors, also known as wind in TCM, so that attack from the outside. The exogenous factors that attack from the outside can also obstruct the ears to cause tinnitus as well as deafness. When it comes to the liver, the fire that flames up in the liver also disturbs the ears, and the liver fire stems from prolonged unhealthy emotions such as angriness, and this will cause tinnitus and deafness since the liver and gallbladder channels go around the ears. Regarding turbid phlegm, this is caused by excessive fatty food intake or phlegm heat body type, and this can also obstruct the ears and cause thereby tinnitus or deafness. And the blood stasis can also do the same. It obstructs the channels around the ears so that the ears lose their nourishment, and as a result, again, you develop tinnitus and or deafness. Western medicine has some treatments to offer to attenuate tinnitus. However, I would like to stress that without solving the original psycho-emotional conflicts that we have discussed, these treatments will not permanently resolve your tinnitus. You must work holistically on all levels, not just suppress the symptoms with whatever technology you're using. But here are some of the treatments that are offered. Anti-stress therapy, often combined with antidepressant and anti-anxiety medications. This addresses the side effects of tinnitus, of course. Then we have hypnotherapy with tinnitus conflict regression. In my opinion, this is the most elegant way of finding and solving the tinnitus psycho-emotional original trigger, and a great natural way to heal tinnitus. Check out our website, christine.doctor, link in the description box below, and you will find there emotional release services to start healing your tinnitus. Then we have what is called masking therapy. That is a method of covering significant noises, covering them up with external noises. So you wear a tinnitus device, and that device generates new sounds and which protect and let the tinnitus sound fade away. Then we have what is termed habituation therapy, and here we add broadband white noises to retrain the auditory pathways, so the keyboard in our brain, to avoid the adverse emotional effects of tinnitus. Wearing a small Walkman or noise generator, as you can see here on the right, the distinction between tinnitus and therapeutic noises becomes smaller and smaller. However, this type of therapy does not work for deaf people and is very slow for people with hyperacusis and hearing loss. The good news is we are here at Christine.Doctor offer worldwide tinnitus and deafness treatments that are performed remotely. Based on the most specific symptoms of your tinnitus, we will identify the real causes. This also takes place remotely. You just have to fill out a questionnaire that we have designed, highlight the symptoms that you have, and we will evaluate your answers and elaborate in conjunction with you a customized tinnitus therapy that works. Of course, we work also on the psychogenic conflict with you to support the physical tinnitus therapy. So we always look at all conditions holistically, and tinnitus is of course no exception. There are different herbal remedies that can improve the functionality of your middle and inner ears, and also some exercises that you can do wherever you are. And I'm gonna leave you with some exercises that we really like. If you've enjoyed this presentation, please support us directly by becoming a Patreon from as little as $5 per month. Link is in the description box below. Alternatively, you can also use the built-in systems on the video platforms you're watching this video on. As mentioned, for the holistic care you need and deserve, do not hesitate to contact us at Christine.Doctor and check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links, as always, also in the description box below. And I would also very much appreciate if you like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. So, I leave you with some exercises that can help you with your tinnitus, and until next time, stay healthy. I want to show you a very simple method to get rid of your tinnitus that is known as the Reddit method, as it was popularized on a Reddit thread where people discuss tinnitus and how to treat it. This is how it works. You take your hands and place them in the shape on the back of your head. You put your index finger over your middle finger, and now you do something like snipping in reverse, meaning you let your index finger snap back from your middle finger. Just like this, so that you can hear the snipping sound. That's all you have to do. So let's do it together. Place your hands on the back of your head, just like that. The palms cover your ears. You feel for the muscle part of your head and place your middle fingers just above that. And then you snip your fingers downwards, just like that. You repeat this 50 times. After you've done this, pay attention to how the sound in your ears has changed. A very simple technique, as you can see. You can use this technique numerous times per day, depending on how severe your tinnitus is. It is possible that you do this just once and you've already resolved your tinnitus. It may also be the case that you have to repeat this procedure every couple of hours. Just give it a try. There are no risks involved, and it might just work for you. If this simple ready technique that I've shown you has not helped, here's another routine that might work better for you on a physiological level. The Eustachian tube is an anatomical construct that often contributes to your tinnitus, or is sometimes even the cause of it, because a congestion or blockage of this tube can lead to tinnitus. In this video I will show you then a simple routine that helps unblock this tube to helpfully solve your tinnitus. The first part of this routine is the opening and closing of your mouth. By doing this, you relax this region, and it might be the case that you hear a crackling or popping sound while you're doing this. It looks like this. You can do it together with me. We do this 15 times. It looks funny, I know, but it works. For the next part of this routine, we put our thumbs into our ears deeply and pull them out quickly in a jerking motion. Here again you will hear a popping sound. So, join me. Let's do this together 5 times. Okay, if you get a sensation that fluid is running out of your nose, you have opened up the tube. So, no worries, this is intended to happen. In our next step, we combine these two methods, meaning you put your thumbs into your ears, pull them out quickly, and close your mouth while doing so. It looks like this. We repeat this 10 times. Let's do it together. Join me. While I'm doing this, I can feel how fluid is running down into my nose, which is a good thing. Next, we will stimulate an acupuncture point, which is located down here at your earlobe. We can do this very precisely with an acupuncture needle, but as we will massage this point with our fingers, covering the whole earlobe, hitting the precise point is not that important. Important is only that you have this area between your thumb and your index finger. And we massage this area for about 30 seconds in this manner. Small circular motions to stimulate this acupuncture point that is responsible for your sensory organs, so your senses like hearing, and therefore also for tinnitus. As said, you do this for about 30 seconds and you can repeat this multiple times per day. For the next technique, we remain in this area of the earlobes with the same grip, but now we pull our earlobes outwards 5 times in a jerky, quick motion. Next, we take care of another acupuncture point, which is located here directly over the beginning, so the top of your ear. You place both thumbs on these points, just like that, and you start to massage the area until you feel a warming sensation. You work here again for about 30 seconds on these points, massaging them in circular motions. I have not checked the clock now, but 30 seconds should suffice. If you feel warmth in this area, that your whole ear has warmed, it means you have done it correctly. In our next step, we will close our nose with our fingers, inflate our mouth and breathe out with an impulse. We do this 5 times. Do it with a light impulse, don't create too much pressure. We are looking for a small crackling or popping noise, similar to the one you get when you dive, for example. If you create too much pressure, you might damage your eardrums. Let's do this together 5 times. Again, with this technique it is important that the pressure is light, just enough to hear a slight popping sound, not like this. If you feel like you have difficulties evaluating the right pressure, you might want to skip this exercise. You can perform these exercises multiple times per day and you will notice how your tinnitus improves or even disappears completely with a little luck. So, have fun with it and hopefully those exercises help you.